Good morning, ladies and gentlemen. It is an honor to deliver her a speech in front of you. I want to extend my overwhelmed gratitude to all of you, especially to our respective teacher, Miss Melanie Vargas. Thank you, ma'am. My speech today is about the reproductive health law. And I agree to it, or I could say that I support RH law. Today, I will address the elements of the new reproductive health law and clauses with a revisit of the many arguments and the law now. The elements of the RH law. What are the elements of the recently enacted RH law? They are family planning information and services, maternal, infant, and child health and nutrition, including breastfeeding, prevention of abortion and management of post-abortion complications, adolescent and youth reproductive health guidance and counseling, prevention and management of reproductive tract infections or RTIs, HIV or AIDS, and sexually transmittable infections or STIs, elimination of violence against women and children and other forms of sexual and gender-based violence, education and counseling on sexuality and reproductive health, treatment of breast and reproductive tract cancers and other gynecologic conditions and disorders, male responsibility and involvement, prevention, treatment, and management of fertility and sexual dysfunction, RH education for the adolescents, and mental health aspect of reproductive health care. The law provides for the following and other things. Midwives for skilled attendance. It stated that the law mandates every city and municipality to employ an adequate number of midwives and other skilled attendants. Emergency obstetric care. Each province and city shall ensure the establishment and operation of hospitals with adequate facilities and qualified personnel that provide emergency obstetric care. Hospital-based family planning. The law requires family planning services like ligation, vasectomy, and intrauterine device or IUD placement to be available in all government hospitals, contraceptives as essential medicines, reproductive health products shall be considered essential medicine and supplies and shall form part of the National Drug Formulary. Their inclusion in the National Drug Formulary will enable government to purchase contraceptives and not merely rely on unpredictable donations. Reproductive health education, RH education, shall be taught by adequate trained teachers in an age-appropriate manner. Employers' responsibilities. Employers shall respect the reproductive health rights of older workers. Women shall not be discriminated against the matter of hiring, regularization of employment status, or selection for retrenchment. Employers shall provide free reproductive health services and education to workers. Capability building community-based volunteer workers. Community-based workers shall undergo additional and updated training on the delivery of reproductive health care services and shall receive not less than 10% increase in honoraria upon successful completion of training. Reproductive health proponents and supporters, such as 30 professors of the University of the Philippines School of Economics, stated that the experience from across Asia indicated that population policy with government-funded family planning program had been a critical complement to sound economic policy and poverty reduction. They reiterated that large family size was closely associated with poverty incidence, as consistently borne out by household survey data over time. Contraceptive use remained disturbing low among poor couples because they lack information and access. For instance, among the poorest 20% of women, over half did not use any method of family planning whatsoever, while less than a third used modern methods of access to contraception had important health implications. The maternal mortality rate, or MMR, already high at 162 per 100,000 live births in 2006. The risk of illness and premature deaths for mother and child alike were known to be increased when mothers, especially young mothers, had too many children that were spaced too closely. Moreover, many unwanted pregnancies resulted in induced and unsafe abortions, numbering 560,000 annually as of 2008. All told, the UP economists believe that the RH and FP programs would offer a win-win solution. These programs would lift the well-being of individual women and children and benefit the economy and the environment as well. I suggest that we should follow and be aware by the elements of the reproductive health law. Be informed as a couples, adolescents, workers, employers, and etc. Especially for the adolescent and youth one. We all need to undergo guidance and counseling. We all need to be educated when it comes to reproductive health material.